Hello and welcome to the third part out of 6 webinars around removable orthodontic appliances. So far, we did intro, classification, forces, and building elements. Let's start with the appliances finally. We will discuss the teeth-supported appliances, in which we consider inclined planes and oral shields. Inclined planes or bite planes may be divided into two types: those which are inclined at an angle to the occlusal plane and those which lies parallel to it. Anterior bite plane lying parallel to the occlusal plane sometimes are called also horizontal bite planes and are designed to produce mainly axial stress to the teeth. Such planes are intended either to prove the bite temporarily, or to facilitate certain teeth movements, or to cause certain adjustment of the vertical relationships to the teeth. Appliance with anterior bite plane. Appliance with anterior bite plane is indicated in the case of a deep bite, for example, when the appliance is worn in the mouth, the posteriors are disengaged so that it will supraerupt. Once the supraeruption is completed, the anteriorly deep bite is opened. This is called opening the bite. So initially, labial bows should not be activated at once the bite is open. Then only labial bow should be activated, meaning the anteriors should be kept within the socket due to the pressure from the labial bow of anterior and acrylic on the palatal side, the anterior part of the anterior bite plane. So this will restrict the palatally and labially tooth movement. Once the bite is open, and we are supposed to activate the labial bow, the anterior part of the anterior bite plane is also trimmed 2 mm per each visit. While trimming, we should also take care to maintain the semicircular shape of the acrylic anteriorly, and that the thickness of the acrylic should be sufficient to disengage the posteriors if needed to raise the bite again. A correctly executed flat bite plane can be seen here. Modification can be made, so let's say, for example, here an anterior bite plane is reduced, but the maxillary incisors are left in the acrylic, which actually activates additionally anchorage to the maxillar plate. And also in this case here, we see that we made a groove for mandibular incisor so that we somehow orientate the correct position of the mandible. Uses of anterior bite plane are mostly to reduce the deep bite or to treat the problems associated with TMJ, while the anterior bite plane is designed to free the existing occlusal contacts in the lateral, which often are abnormal due to loss of the teeth, tilting of the remaining teeth, and or presence of a high spot on the occlusal plane due to ongoing or after the orthodontic treatment. We also have some problems with the anterior bite plane. For example, if the lower incisors are severely proclined or retroclined, some unwanted changes in their position may occur. If it arises, the inclined bite plane is given so that the surface is perpendicular again to the long axis of the lower anteriors, which all now distributes the forces to more axial. Also, if it is worn for a longer period, we can experience a sinking of the appliance, which means that the teeth are actually placed anteriorly, causing upper anteriors to procline. If the bite plane sinks, the labial bow moves forward with it and cannot restrain the upper incisors anymore. An anterior bite plane transmits normally the pressure axially to the upper incisors, but if any tipping component is restricted because the anterior bite plane is together with the labial arch, preventing the upper incisors from this movement. But as I said, if it's sinking, then it starts to procline a little bit and we have to react on it. Also, once we are indicating the inclined bite plane, we do this inclination which faces downwards and forwards at an angle of 60 degrees to the occlusal plane and engages the lower incisors and the canine when this is guiding the mandible forward. So the inclined bite plane reinforces the anchorage and proclines the lower anterior in addition to the correction of anterior deep bite, but also kind of a mandibular repositioning splint. If we look at this picture here, we exactly see what is going on. The upper anterior inclined plane is guiding the mandible, also correcting the bite. So when the mandible is brought to the centric occlusion, the lower incisors are actually kind of sliding over the guide plane to bring the mandible forward. For the posterior bite planes, we can give them on both occasions, unilaterally or bilaterally. The unilateral posterior bite plane is indicated for a correction of a unilateral crossbite or simple or some number of tooths or even the whole group of posterior teeth, depending on the case. In this case, we can also put some expansion screw in it. The expansion appliance can be also given with a unilateral or bilateral bite plane. The bilateral posterior bite plane is given when there is a major anterior cross bite, especially. The base is carried onto the occlusal surfaces of the posterior, and in that way it gives us the possibility to disclude the whole situation in the front, so the thickness of the bite plane should be sufficient to disengage the anterior teeth, which are in the cross bite. The posterior bite plane should not be too bulky. While constructing the posterior bite plane, the care should be taken not to increase the same thickness of acrylic at the posterior very end. Otherwise, the patient cannot close the mouth, which is going to cause inconvenience, and also the compliance will be very low. In that case, excess acrylic trimming might be necessary on the chair side to maintain the sufficient frontal teeth disengagement and also to make it more comfortable to wear. I would like to address a little thing on oral shields. We will discuss them from the vestibular side on the other part of the lectures, but here we will talk a little bit on a lingual shield, because this lingual shield, which is teeth supported, is also restricts the resting tongue position. So the idea is that neither tongue or thumbs, fingers and other objects can be positioned in between the teeth. We are closing the open bite. The acrylic shield is placed behind the teeth, leaving the anterior teeth free to erupt, while typically the posterior are blocked. And that will be all for this part, the third part of teeth supported appliances, and the next part is going to deal with teeth tissue supported appliances. So see you soon. Have a nice day.